Greetings and welcome. My name is Brad Monk. I'm a gynecologic oncologist, director of the GOG Partners, and here in West Palm Beach, where I work for Florida Cancer Specialists and Research Institute. I'd like to talk to you about oral mucositis. Oral mucositis is an adverse event, generally treatment related, that we are seeing with some of our TROP2 directed antibody drug conjugates. And as you know, the GOG Partners Organization has several studies that are very intentional in defining the role, the biomarker, the dose, and the schedule of these TROP2 directed ADCs. So these agents have been associated with oral mucositis. And I'd like to spend just a few minutes with you today to talk about the CHEMO mouthpiece. It's a proactive strategy for patients. It's an innovative oral cryotherapy device to reduce the incidence and severity of this potential adverse event, oral mucositis. So I'll walk you through this. But if I know anything about oncology quality of life, is that we have to understand the side effects of the agents that we're using, number one. Understand. Number two, we have to teach awareness. Teach awareness involves a screening for the adverse event, mitigation strategies, and then once they occur, hopefully detecting these adverse reactions early and treating them. And then third, working with the patients and our staff. So number one, understanding. Number one, teaching each other as providers, but then expanding that education to patients and providers. So this is an agent. You see it on the left. It is a device that is placed in the oral cavity. It has an inner blue chamber, and then which is filled with water and is frozen in the freezer. These are reusable devices, and then they're inserted in the mouth with the lips covering them to create vasoconstriction and reduce the delivery of the cytotoxic agent to the oral mucosa. So you see on the left, it comes with an igloo, a cooler, if you will. There are several of them. There are 6 of them. You put them in the freezer, put them in the igloo, and then the patient can carry them to the infusion center. It takes about 30 minutes for them to thaw. You start them about 10 minutes before the infusion, continue them about every 30 minutes as the infusion happens, and then ultimately they can be used at home. Very innovative. Cryotherapy works in mitigating adverse reactions due to vasoconstriction. Just look at these cold caps that reduce alopecia. Look at the eye cooling devices that we do for ocular adverse events, and even gloves to reduce peripheral neuropathy. This is a very interesting scan where you can see that the CHEMO mouthpiece, which reduces the oral temperature by an average of 31 degrees, while ice chips are not as effective. And this cooling causes vasoconstriction after about 30 minutes and is sustained. And again, if the antibody drug conjugate is not delivered to the oral mucosa, then there will be fewer side effects. So again, this is its device use. Very simple. It comes in a sealed package. You open it, you freeze it, put it in the cooler, bring it to the infusion center, and you can also use it at home. Again, these are reusable. Just wash them with soap and water. The igloo is there on the right. I have personal experience. My patients discovered this. My patients brought this to me. I generally use it once grade 2 adverse events occur. And as you remember, grade 2 oral mucositis means that you should interrupt, but don't dose reduce, so you start again, which means it's just going to happen again. But if you get a grade 2 oral mucositis, you use it, hopefully it will be prevented and dose intensity can be maintained. So again, 10 minutes before the start, use a new device every 30 minutes. If you need a 5-minute break for your patient, that's fine. Try to use it 2 or so times that same day at home. Again, if it's a late infusion in the day, maybe only once. And then ultimately, depending on the half-life of the medication, 2 to 6 days once the patient is at home. Generally, the TROP2 antibody drug conjugates that we're using have a shorter half-life, so probably 3-ish to 4 days, probably adequate. A minimum of 2 times a day when the patient is home, but if the patient could spare, 4 30-minute sessions, that's what we would use. Now, this has been studied in a randomized trial, mostly in breast cancer and GI tumors. And again, you can't really look in the, I guess you could, look in the mouth and see how severe it is, but you can ask the patient how much pain they're in. And that's sort of the objective measure of oral mucositis, and that's certainly what we're trying to do, is improve the patient experience. So this shows the pain outcomes, and you can see CMP stands for chemo mouthpiece versus control. It was about 50% reduced. Again, the reference is there for you. And what's most important, another objective measure, is how much opioids or analgesics they're using. So this is a methodology that I would recommend for you to consider for your patients. Again, I'm here as part of the GOG because this is now being provided free of charge to your patients on some of our TROP2 antibody drug conjugate studies. So thank you for spending a few minutes with me. Thank you for doing what you're doing, enrolling patients on clinical trials to help them live longer, and in this case, even reducing side effects. So thank you, and so long for now.